Ever seen that movie, The Remains of the Day, with Anthony Hopkins, who played an English butler? He struggled to express his emotions throughout the movie and failed to have relationships even though he was loved by the housekeeper. His acting portrayed characteristics to individuals with schizoid personality disorder, SPD. Schizoid personality disorder isn't just about being shy or antisocial. It's a complex condition that challenges our very understanding of human connection. Welcome to Brain Explained. The story of schizoid personality disorder goes way back into the early 20th century. Eugen Bleuler, the psychiatrist who coined the term schizophrenia, was one of the first to describe it. He noticed some folks who seemed to keep to themselves a lot, almost like they were disconnected from the world around them. So as time went on, piece by piece, more researchers gained insight into the personality type, and a clearer picture was formed. And by the 1950s and 60s, schizoid personality disorder had gained a lot of attention in the psychiatric world. People with schizoid personality disorder often prefer to play solo. They're not the types you'll find at parties or big social gatherings. In fact, they might go out of their way to avoid social situations. One striking fact about these individuals is that they're not shy or scared of people. They just don't feel the need to connect with people the way others do. Another thing you might notice is that they don't show much emotion. So they might come across as cold or indifferent, but it's not because they're trying to be mean. It's just how they're wired. And eventually, it is hard for them to express their feelings or react in situations like other people would. Individuals with this disorder often have a rich inner world where they have vivid imaginations and spend a lot of time daydreaming. But when it comes to the outside world, they appear detached, not caring much about praise or criticism from others. And when it comes to relationships, it's worse. They rarely have close friends, and often don't show interest in romantic or sexual relationships. Not because they're afraid of getting hurt, but because they don't feel the need for these connections. People with SPD often don't see their behavior as a problem. They're usually content with their solitary lifestyle. So it's often the people around them, like family members or coworkers, that find their behavior odd. It's important to note that having some of these traits doesn't automatically mean that a person has schizoid personality disorder. Of course, we all have moments when we want to be alone. But with schizoid, these traits are long-lasting and show up in pretty much every area of a person's life. So what is going on inside the brain of someone with schizoid personality disorder? In the brain of someone with SPD, the areas responsible for social connection and emotional processing don't quite fire up the same way. Imagine the brain has a social circuit that usually lights up when we interact with others. In someone with the schizoid personality type, this circuit is kind of dimmed. At the same time, the parts of the brain that handle independent thinking and self-reliance are often in overdrive. Much like the brain is saying, we don't need others, we're good on our own. Emotional processing centers are also a bit muted, making it harder for people with SPD to express emotions or pick up on emotional cues from others. So far, researchers conclude that the brains of people with schizoid personality disorder may have reduced gray matter in specific areas of the temporal lobe and in the center of the brain, like in schizophrenia. In most of the studies, however, the subjects with SPD do not have all of the abnormalities that might be present in schizophrenia, which is why it is not considered a subset of schizophrenia. Mental health professionals use the DSM-5, which contains a list of specific criteria for schizoid personality disorder. So, to be diagnosed, a person must have shown at least 4 of these traits. Not wanting or not enjoying close relationships, always choosing solitary activities, having little or no interest in sexual experiences with another person, taking pleasure in only a few activities, lacking close friends other than first-degree relatives, being indifferent to praise or criticism from others, and showing emotional coldness and flattened affect. But these traits must have shown up for a long time in different aspects of the person's life, especially since early adulthood, to truly say an individual had the schizoid personality type. It's also worth noting that diagnosing schizoid personality disorder can be challenging, mainly because many people with this disorder don't seek help on their own, since they often don't see their behavior as a problem. So they don't seek help until they begin to face difficulties at work or in relationships. The goal of treatment in schizoid personality disorder isn't to turn the individual into a social butterfly, but to help them function better in their daily lives and manage any distress they might feel. One type of therapy that can be helpful is cognitive behavioral therapy, CBT. This approach helps people identify and change thought patterns and behaviors that might be causing problems in their lives. For someone with schizoid personality disorder, this might involve learning to recognize and express emotions or developing strategies to handle social situations when necessary. And even though group therapy might sound like a nightmare for someone who avoids social interaction, it can be beneficial. It provides a safe space to practice social skills and learn from others who might be dealing with similar issues. Psychodynamic therapy, on the other hand, digs into a person's past experiences and unconscious thoughts, thereby helping them understand why they might have developed their detached way of relating to others. Thanks for watching. Click subscribe to learn more about personality disorders.